Hi everybody, my name is Jarrod Zamparini. I'm a specialist physician working in the Division of Infectious Diseases in the Department of Medicine at Charlotte Masheke Johannesburg Academic Hospital. We understand that there's been a lot of panic and a lot of misinformation going around about COVID-19 and SARS-CoV-2. So we've put together this slide set to help you understand what you need to know about COVID-19. We hope that this helps you answer some of the questions that you might have about the disease, and that you can take this information back to your families and community and answer some of their questions. So let's get straight into it. So, what do you need to know about COVID-19? Well, to start with, I'm sure a lot of you have seen these headlines going around. Panic buying hits SA, South Africans are panic buying, Europe is closing their borders, South Africa's closed their borders. Of course, people are buying hazmat suits, hand sanitizer and face masks are flying off the shelves. The JSE is being hit by the virus. So you'd be right in feeling like this, feeling a lot of panic at the moment. But at the same time, we've seen a couple of these headlines. Here's why you shouldn't panic over the coronavirus. Elon Musk, Warren Buffett saying don't panic about the coronavirus. And President Trump saying it'll go away. So there's also a lot of people saying don't panic, which leaves you in a bit of a confused state. Do you not panic or do you panic? Well, let's give you the information so you can decide for yourself. To start with, what is COVID-19? So it's short for Coronavirus Disease 2019. You can see that's how they've come up with the name of it. You may have also heard about SARS-CoV-2. Well, that stands for Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. An easy way to think about it is, just as HIV is the virus that causes AIDS, SARS-CoV-2 is the virus that causes COVID-19. Now, you may have heard it called nCoV or the novel coronavirus. We've come up with this name, the Coronavirus Study Group put it together, and basically what they looked at is you've got your Middle East respiratory syndrome caused by MERS-CoV, severe acute respiratory syndrome caused by SARS-CoV, and then SARS-CoV-2, which causes coronavirus disease 2019. So SARS-CoV-2 is a coronavirus. It's part of the family Coronaviridae. There are about 40 species in this family of viruses, and they cause diseases in mammals and birds. In humans, they cause respiratory disease, and the thing is, regular human coronaviruses account for about 30% of the viruses causing the common cold. Zoonotic coronaviruses, or viruses that come from animals, include SARS-CoV, SARS-CoV-2, and MERS-CoV. And it's named coronaviruses for the Latin corona, for crown, because these things on its surface, they say, look like crowns. So just go through a timeline of the outbreak. So on the 31st of December 2019, the WHO was informed of cases of pneumonia of an unknown cause in Wuhan City in the Hubei province of China. On the 5th of January, it was first reported in the news media of a mysterious pneumonia outbreak that sickened dozens in China. On the 7th of January, China reported that it may be linked to a new virus which was isolated in one of their labs. On the 13th of January, virus at that time called the Wuhan virus first appeared outside of China in Thailand. 23rd of January, the death toll started climbing and there was global alarm around this. On the 31st of January, it was declared a global health emergency. On the 5th of February, a cruise ship, the Diamond Princess, was quarantined for 2 weeks off the coast of Japan. This is important because a lot of good data that we have about this comes from this cruise ship. Then on the 11th of February, it was officially named COVID-19. At this point, the death toll was over 1,000 and infections were more than 42,000, still mainly in China. Although by the 27th of February, there were more new cases outside of China than inside, according to the WHO. And on the 5th of March, the first case was reported in South Africa. Now, the total number of cases in South Africa has grown rapidly from that very first case reported on the 5th of March to now on the 16th of March, where we have 62 cases. Now, this is quite a nice video that shows you just how the virus spread around the world. And as you can see, it started out in China. The cases grew at the end of January. started spreading throughout the East, and then we had our first cases in Europe, America, and Australia. Then it just continued to spread all over the world. In February, a lot of Europe was starting to be affected, and then coming up here on Valentine's Day, the first case in Africa, in Egypt. It just continued to spread, and as the alert was raised, more and more countries started testing, and as you can see there, it just explodes all over the map. Going through March, you can see the first case there in South Africa, and this goes up to the 16th of March. South Africa still has a small yellow dot there, whereas we actually do have 62 cases, so we should have a nice big red dot over us. The question people ask, though, is how infectious is this virus? Well, we look at something called the R0, which is the reproductive number, and that's basically if without medication, without prevention, how many people will one person with the virus or with the infection affect or infect. So as you can see here with coronavirus, with COVID-19, if one infected person will infect 2.5 people. That's compared to something like seasonal influenza, where one person infects 1.5 people, SARS, 3.5 people, and then something like measles, where one person infects 15 people. Bearing in mind, I don't have it on the slide, but HIV affects, if you look at its R0, it's between 4.5 and 6, so a lot more infectious than COVID-19, although it's not spread through droplet spread as these viruses are. TB, which we all have a lot of experience with, has an R0 of about 1 affects 10 people, and we all have a lot of experience with that disease. So you may have also heard about the incubation period. Well, what that means is basically you've got over here a person who's infected who then coughs, and they don't follow proper cough etiquette, which we'll talk about later. That person then coughs, and this person becomes infected. And we expect that within 14 days of exposure, the person will start to show symptoms. Another study from China has shown that this incubation period is actually between 2 and 11.5 days. And the reason that this is important is you hear about people having to self-isolate or quarantine for 14 days. And this is where that number comes from, is that we've shown that within 14 days of exposure, you should have started showing symptoms if you are infected with the virus. So the question is, what are the symptoms? Well, 89 to 99% of people infected have a fever, up to 70% feel fatigue, and 59% have a cough. Another 31% will have dyspnea or shortness of breath, and 35% will have myalgia or muscle aches. Although the symptoms alone aren't enough for us to test, so we use criteria originally developed by the WHO and adapted by the NICD, the National Institute for Communicable Diseases. So this is from their website. It's valid as of the 16th of March. So if you're watching this a lot later than the 16th of March, just have a look at their website to see the most recent case definition. So basically what it is a person with an acute respiratory illness, so including at least one of a cough, sore throat, dyspnea, fever, or a history of fever. So if you have one of those and the 14 days before you developed that, you either came into close contact with a confirmed or probable case of SARS-CoV-2, or you worked in or attended a hospital with SARS-CoV-2 patients, or you have a history of travel to areas with local transmission of SARS-CoV-2, or you're admitted with severe pneumonia of an unknown cause, then you should be tested for SARS-CoV-2. So just remember, it's someone with the acute respiratory illness and one of the following, doesn't have to be all of them, has to just be one of them, 14 days before you develop that respiratory illness. So Charlotte Macheke is a hospital that has treated SARS-CoV-2 patients. So if you work in our hospital and you develop any of these, you should be tested. Countries with local transmission can be checked on the NICD website, and there are a number of those. And so with our borders being closed now, we're less likely to see people with this over the coming weeks, but more with these over here. So how's the diagnosis made? Well, this person over here in yellow is suspected. He meets that case definition. In hospital, he will then be given a face mask, and I'll talk more about face masks a bit later, and then taken to an isolation cubicle. where a nasopharyngeal swab will be done. And what this is a swab put through the nose into the back of the throat, so into the nasopharynx. It's then turned around and a sample is taken. This will be done by the emergency department and other doctors in charge of screening, but it's good to know how it's done. And it's important as well that this isn't just sent off in any swab, it has to be sent off in viral transport medium, and it has to be at a certain temperature, between 2 and 8 degrees. So the next important question is, how severe is it? How bad is this disease really? Well, a big study from the Chinese Center for Disease Control and Prevention that included about 44,500 confirmed infections showed the following numbers. 81% of people had mild disease, so that's either no or mild pneumonia. 14% had severe disease, and that's shortness of breath or hypoxia, so low oxygen levels in the blood, or more than 50% of lung volume on imaging. So more than 50% of the lungs are affected either on X-ray or scan. 5% have critical disease, so they either have respiratory failure, shock, or multi-organ dysfunction. And these are people that need to be ventilated or might need renal replacement therapy or inotropic support. The thing is, though, on the Diamond Princess, which was that cruise ship quarantined off the coast of Japan, they quarantined that ship and everyone was tested. Just over 600 people were confirmed to have the disease, and of those 600 or so people, 48% were asymptomatic. So with our case definition, we're only testing people with symptoms. So the question is, are we missing a lot of cases? And we'll have to get more data to see if this is the case. Of course, everyone wants to also know is how many people die from this. Well, in that big study from China in Wuhan, 2.3% of people who were infected with SARS-CoV-2 died. So that's just over 2 for every 100 people infected. Globally, as of the 17th of March, we're looking at 3.9% of people, so just under 4 in 100 die. And on the Diamond Princess, where again we said that they tested everyone, so even the asymptomatic people were included, 1% of people infected with this virus died, so 1 in 100. So to put that into perspective over here, this scale over here looks at the percentage of people who die versus the people infected. So COVID-19 is in this box over here, around about 2.5 people infected and about 1% or so die. Now compare that to something like bird flu, where a lot more people die but it's less infective, or something like chickenpox, where it's very infective, so one sick person infects a lot of people but has a very low mortality. We all are familiar with TB. So with TB, untreated, about just over 10% die. This shows that there are about 2 people infected. We know from South African data that it should probably be around here. Then, of course, HIV. Now, HIV, as we've said, isn't spread via droplets as a lot of these other diseases are. But we all have a lot of experience with HIV, and we know about HIV. So as we said, HIV infects about between 4.5 and 6 people. But if you don't treat HIV, so untreated HIV has a mortality rate of more than 90%. So the scale you can't even show it on this scale. So that's important to know. But it's not that simple. Just because the mortality rate is 2%, 3%, 1%, whatever we're looking at from whichever study, it actually depends on your age and what coexisting conditions you have. So people over the age of 80 in that Chinese study had a 14.8% chance of dying. So that's 15 for every 100 infected. As opposed to those under 9, where there was no mortality. So no children infected died. And as you can see, it goes up slowly, where suddenly in your people over 60, it's 3.6% and 8% in those over 70. It's the same thing for those with existing conditions. If you have cardiovascular or heart disease, your mortality rate will be 10.5%. Or the expected mortality rate is 10.5%, so 10 in every 100. And the same with diabetes, chronic respiratory disease or lung disease, very high blood pressure, and cancer. Your mortality rate is much higher than for those with no existing conditions. This is data. The chart on the left-hand side of the screen is how many people have been infected versus how many deaths. And this is also important because, as you can see, In China, we're looking at about 3.9% mortality rate or case fatality rate. Whereas in Italy, where they've had a severe outbreak, their case fatality rate is 7.7%. Somewhere like South Korea, theirs is less than 1%, all the way down to looking at Norway and Austria, 0.2%. And the important thing to know about this is that we only know how many people are infected if we test them. South Korea has done 210,000 tests. This is up to the 9th of March. In other words, they've tested 4,100 per million people in their population. Italy, much less, only 1,000 per million people in their population. And I haven't actually even included, the USA has fallen off of this list because it was way under 100 people that they're testing. In South Africa, the NICD has done an amazing job so far. They have been really busy, but they've managed to conduct 2,400 tests in the space of about 11 days. From that, by the 16th of March, we had 62 positive cases, and the rest were all negative. We are lucky so far we've had no deaths. But what all countries really need to do is increase the number of tests that are done in order to find the cases. So to finish up on mortality rate, well, looking at, now what about pregnant patients? Well, pregnant patients, up until now, there are only 18 pregnant patients reported in the literature. Of those, there have been no mortalities yet, and it's important they've shown no vertical transmission. So pregnant moms don't look like they can transmit this virus to their unborn babies. And that's from a big study, or not a big study, a study done out of China with 9 moms. And as soon as the babies were born, they checked cord blood, umbilical cord, tissue, amniotic fluid, and breast milk. And they showed in all of those that there was no virus that they could detect. A lot of the data, or a lot of what we're thinking about pregnant patients is from SARS in 2003. And in 12 patients reported then, there was an increased rate of first trimester miscarriage, increased fetal growth restriction, and increased preterm labor. And of that group of 12, there were 3 deaths. But at this point, we just don't know enough about pregnancy and COVID-19. What about children? Well, in those under 20 account for only 2% of infections. And symptomatic infection seems to be uncommon, and those that are symptomatic are very mild, and no cases in a small study, again in China, required supplemental oxygen. So what about treatment? Well, at the moment with COVID-19, the prevention is definitely better than the cure. So you may have heard a lot about this in the last few weeks, but the first thing is social distancing. So you want to keep between 1.5 and 2 meters away from every other person. And the reason for this is quite simple. If someone coughs, so this gentleman here in red, he doesn't practice proper cough etiquette and he coughs. So his droplets, those green things over there, land, and they don't go further than 1.5 meters, which means that blue gentleman over there is outside of the firing zone of those droplets. Now let's say the same person coughs, and he coughs onto a table. The problem with that is this person can then come along and touch that table and get the virus on his hands, and we'll talk about that a bit later. So you need to practice proper cough etiquette. Cough into your elbow. It means that you don't spread the virus, you don't spread your droplets with the virus in all over the place. If you don't want to cough into your elbow, you can also cough into a tissue and then throw that tissue away and wash your hands, or cough into a handkerchief and then make sure you wash that handkerchief and don't share it. So hand hygiene is important. So we shouldn't be shaking hands. We should be washing our hands regularly. And the reason for that is that it looks like the virus can survive for between 4 and 24 hours on surfaces. Depends on the type of surface. Smoother surfaces, the virus survives for longer. And sort of rough, porous surfaces, it survives for much shorter because it can't get out of those small pores. So washing your hands is important. The thing with washing your hands is you need to do it properly, so for at least 20 seconds, and there's a lot of songs and things that are out there on the internet that you can look at for how to make sure you wash your hands for 20 seconds. And really, Lifebuoy has jumped onto the market here, but they're not wrong. Soap is an effective way to fight coronavirus. But it's not just Lifebuoy, it's not fancy soaps. You don't need to go and buy that stuff that smells like coconuts and vanilla. Any soap, even just a regular bar of soap, kills the virus. And the reason for that is the outside of the virus is a lipid bilayer, or a layer of fat. So when you add soap to that, it completely destroys that and the virus just falls apart. A good way to think about it is imagine a greasy pan, and you add sunlight or dishwashing liquid to it, and those grease particles just disperse across the pan. That's what soap does to the virus. Similarly, don't touch your face, because again, you may have touched the surface where the virus survives, and then touch your face and the virus gets into your nose and mouth, and you can be infected. Again, which is why it's important to wash your hands regularly, and also use hand sanitizers, although these hand sanitizers must have an alcohol content of more than 60% at least. You should also avoid mass gatherings. It goes into that saying of keep 1.5 meters apart. So don't go to the movies, don't go to church or mosque or shul or temple, because that's a mass gathering, and don't go to sports events. This is a lot less relevant now because mass gatherings of less than 100 people have been banned by the government, but really it's important for your health and the health of others. And then if you do feel sick, if you have those respiratory symptoms, self-isolate and contact your GP or contact the NICD hotline, which is available on their website. Of course, the question is, does this work? Does social distancing and hand washing and all of this work? Well, we've got some information from history to show us that it does work. So in the 1918 flu pandemic, there was a story of two cities in America. The one is Philadelphia in Pennsylvania. In that city, sailors with influenza symptoms arrived in port back home from World War I, and a couple of them developed influenza. A few days later, they went on to hold a military parade. That was on the 28th of September. 200,000 citizens attended this parade. 72 hours later, every bed in the city's 31 hospitals was full. A week later, 2,600 people were dead from flu, and 2 weeks later, 4,500 people in Philadelphia were dead from influenza. You compare that to St. Louis, Missouri, where, again, sailors arrived with flu symptoms in port. 2 days later, the Health Commissioner issued an emergency order which closed all schools, playgrounds, pubs, and churches, and attendance at funerals was restricted. And this is what the difference was. In Philadelphia, the parade was held on the 28th of September. By about a month or under a month later, they had 250 deaths per 100,000 population. Then everyone had died, unfortunately, and their death rate dropped off. Whereas in St. Louis, they banned mass gatherings and they ensured social distancing, and their death rate never really climbed to definitely not more than 50 per 100,000 until December, their cold winter. So does this work with COVID-19? Well, this is a graph from Korea. And as you can see, round about the end of February, beginning of March, over here, they started enacting strict social distancing, and their numbers have just dropped off significantly. And that's because in South Korea, what they've done, this is a picture from someone's account on Twitter, you can follow the link there on the slide. They've done mass social distancing. So they have drive-through testing centers to make sure people don't congregate. If you go into an elevator in certain buildings, they have chopsticks with hand sanitizer, so you can press the button with a chopstick and then throw it away. In restaurants and banks, they've put up these glass barriers so that you're shielded from everyone else. And if you feel sick, you're not allowed to just arrive at a hospital. You have to either phone or SMS ahead, and they then tell you where you should go and which triage queue you should join. So we've also had a lot of questions about face masks. We've seen people in our hospital wearing face masks. We've seen people across the world buying face masks and hoarding face masks. Well, the two face masks that everyone really knows about or is familiar with, the first is a surgical mask. What that is, it's designed to prevent droplet spread from the wearer to the general public. So that is, if you are infected with SARS-CoV-2 or if you have any other cold or flu and you're coughing and sneezing, that prevents you from coughing or sneezing into the environment without having to cough into your elbow or into a tissue. It also prevents wearers from being splashed in the mouth by body fluids. So if you're performing surgery and there's things splashing around, you don't want that to get into your mouth. What they don't do is prevent the wearer from inhaling particles the size of a virus, which is why wearing a surgical mask to prevent yourself from getting COVID-19 is pointless. What about N95 masks? Well, N95s are designed to prevent inhalation of particles larger than 0.3 microns, or 3/1000th of a centimeter, with 95% efficacy. And that's where the name comes from, the 95. This should be used by healthcare providers that are doing procedures which cause aerosol formation. So that is if you are intubating a patient, if you are doing a bronchoscopy, or if you're doing chest physio, amongst other things. The problem is at the moment there's a global shortage of N95s. So if everyone's using them inappropriately, we're not going to have enough for the healthcare providers that need to use them when they're doing these procedures. And that's why, again, it's also you shouldn't be using an N95 unless you're doing one of those procedures. So what should you be wearing? Well, for healthcare workers who have direct care to COVID-19 patients, you're looking at a surgical mask, gown, gloves, and eye protection. So that's either goggles or a visor. Or if you're doing aerosol generating procedures, then an N95 mask, gown, gloves, eye protection, and an apron. So booties are not necessary for this. This is the PPE that the WHO recommends. For cleaning staff, if you're going into the room of a patient with COVID-19, then you should be wearing a surgical mask, a gown, heavy-duty gloves, and that's because just normal gloves are very fragile, and so with mopping and sweeping and cleaning they might tear. Eye protection, again, goggles or a visor, and then boots or work shoes to protect yourself. What about other staff? And this includes administrative staff as well. Well, if you don't have direct contact with a COVID-19 patient, then you do not need to wear PPE. And now I'm sure you're sitting there thinking, are you sure I don't need a mask? So let's go back to these guys here. So our man in red here, who's infected, doesn't practice proper cough etiquette, and he coughs. These droplets then fall 1.5 meters. So this man over here is outside of that 1.5 meter area, 1.5 meter range of those droplets. So he's unlikely to be infected, which is why he doesn't need a mask. Now let's say again, our same man over here coughs onto the table. This time this man is wearing a mask. But what happens now is he goes here and he touches the table. He's then wearing a mask, which is irritating. It's uncomfortable to wear a mask all the time. So he takes off the mask before he's washed his hands or sanitized his hands. He then puts himself at risk of getting that virus into his nose, into his mouth, and being infected. So I'm sure you've all heard this term, flatten the curve. So you saw that South Korean curve, you saw the curve with Philadelphia and St. Louis. And really what we're saying is, you may have heard people saying, whatever, it's just like a cold or bad flu. We're not going to flatten the curve that way, and we are going to overwhelm the healthcare system. What you should be saying is, don't panic, but be careful. So wash your hands, don't touch your face, stay at home when you're sick. And we'll flatten out that curve so that we don't overburden the healthcare system. So I'm going to leave you with this. More people die from car accidents than bear attacks. So you could say that more people die from TB than COVID-19. But if you saw a sleuth of bears, really that's the name, running at you, you wouldn't say to the bear, cars kill more people. You'd take that time to attempt some social distancing maneuvers really fast. So all I can say to you is, don't panic, but be careful. Thank you for watching our video on COVID-19. We hope that this may have answered some of the questions that you had about this disease and that you can take this information back to your families and communities. If you have any questions or comments on this video, please email us at cmjahcovidinfo@gmail.com and we'll try to get back to you within 24 hours. Please also keep an eye out for more videos like this so that we can keep informing people and keep informing our community about COVID-19. And remember, don't panic, but be careful.